Hello and welcome to Dr. Ankur's dental lectures. Today we are going to talk about inflammation. Inflammation is a protective vascular response towards exogenous and endogenous stimulus causing cell injury. It is aimed to get rid of initial cause of cell injury and its consequences, including the necrotic cells as well as tissues. Acute inflammation can be studied as a series of events occurring in blood vessels. First of all, that is the vascular changes, including vasoconstriction, vasodilatation, and slowing of circulation, and cellular events, that is, the changes in the cells, and finally, the chemical mediators acting as the catalyst for various steps in these events. After an inflammatory stimulus like injury, there is a transient vasoconstriction causing flushing of tissues that lasts for a few seconds. After this, there is a vasodilatation which causes increased blood flow and increase in protein poor fluid flow from capillaries, which is known as transudate. Transudate is later replaced by exudate, which is protein rich fluid. This is formed due to increased microvascular permeability causing slowing of circulation and leakage from the vessels. Leakage is due to endothelial cell contraction, or maybe due to direct endothelial injury, or maybe leukocyte dependent. In case of endothelial cell contraction, it is short, immediate transient response which occurs only in venules, whereas direct endothelial injury may be immediate sustained response which occurs in venules, capillary and arterioles, or a delayed prolonged response which occurs mainly in venules and capillaries. The leakage may be leukocyte dependent because leukocytes produce toxic oxygen and proteolytic enzymes. Finally, this leakage causes exudation, which leads to increased interstitial osmotic pressure causing edema. So that was the vascular part. Coming on to the cellular part, or the cellular events in acute inflammation. Normally, there's a central column in the flowing blood containing the cells. When the central column containing the cells slows due to increased microvascular permeability, the leukocytes first of all move towards the margin of the vessel, which is known as margination. So they move towards the endothelium and they start rolling on the endothelium, and finally they adhere to the endothelium. This process is of course known as adhesion. Finally, because there is an increased microvascular permeability, there is a transmigration of these leukocytes to the interstitial tissue, from where they reach the place of the stimulus through chemotaxis, that is, and they are attracted towards the chemical mediators, and finally over there they phagocytose the foreign bodies, and finally there is a degranulation. So that was about the cellular events in inflammation. Now let us move on to the chemical mediators of inflammation. There are various chemical mediators of inflammation. Important ones are vasoactive amines, plasma proteases, including clotting system, kinin and component system, platelet activating factors, cytokines, and arachidonic acid metabolites such as leukotrienes and prostaglandins. First, let us talk about vasoactive amines. An important vasoactive amine is histamine. So what histamine does is that it acts at two places, or at the two steps of inflammation or inflammatory response. First of all, it causes vasodilatation and increased microvascular permeability. Plasma proteins, clotting system, and clotting system, fibrinolytic system causes activation of kinin system and production of bradykinin, whereas fibrinogen, it causes two important things. First is that it causes chemotaxis of the leukocytes once they are outside, and also it can also cause an increased microvascular permeability. Coming to bradykinin, bradykinin causes endothelial cell contraction. first of all, and it is also an important mediator which causes response or increased microvascular permeability in venules. Now, let us come to arachidonic acid metabolites. Leukotrienes, leukotriene B4, C4, D4, and E4 are the ones that act in inflammation, and they cause various changes such as vasoconstriction or increased microvascular permeability. Leukotrienes are the next ones. Before leukotrienes, let's talk about prostaglandins. Prostaglandin D2, E2, F2 and thromboxane A2 are important. These cause vasoconstriction importantly. Prostaglandins may also cause fluid accumulation and edema. So we'll talk more about this in another lecture about the chemical mediators of inflammation, where these will be told in details. I hope you found this lecture interesting and useful. Thanks for watching, and bye-bye.